Last October, I went to work and I was just walking up to where I work at, and I was getting out of breath and I didn't have any energy, so I had to stop, and I was like, oh, something's going on here. I'm having a hard time breathing. Luckily, my brother was coming in. He worked at the same place, and he didn't want to know what was going on. I said, hey, I need you to drive me to the hospital. I said, something's happening. And once I got in the car, I started getting where I couldn't breathe. So we had to stop in the parking lot, and we called the EMT, and they came and got me. And then I went to Iredell.
Within the first 15 minutes of meeting him, he had a lot of things happen quickly because that was just what the circumstances needed. And we knew right away that he had a very weakened heart and that his circumstances were very critical.
Luckily, Dr. Martin was on duty, and he told me the things they were going to do and what they were going to try. So, and then after that, I blacked out, and I think I was out in a coma for like 3 days.
He did pretty good pretty quickly. I mean, you talk about where he was, and honestly, if he waited another couple hours, he might not have survived.
Recovery has been long. I went to the Iredell rehab, which was a great program.
We just gave him a plan as far as exercise goes, and then we just kind of helped him along to meet his personal goals and the goals that we set for them.
We have education. Of course, we have exercise, which is the main component. We have a dietitian that speaks with patients. We also will have some ways to meet some psychosocial needs, and it's all works together to help them better their health after basically a cardiac event.
It's so great that the hospital has let the ones that have actually graduated stay on through the end of the year and exercise, and that's all due to the grant that we have.
I also know there's another little lady in a class that has had some problems with her copay, and I think the foundation has probably helped with that and has helped her to be able to continue to come.
Last year, and with some of the funds that we raised, we were able to get some equipment that certainly help us. We have some new technology with our echocardiograms, which we utilized in this case. And to be able to have, state-of-the-art equipment, especially in these quick circumstances, to make rapid decisions that ultimately save lives in those acute situations, but also help us manage people for more chronic conditions. It's good for the community, it's great for us, because the more resources we have, the easier our job becomes.
We're all connected in this community. So if you're giving money to this organization, that's going to go to somebody you know.
I'm very grateful. I can't thank people enough. They saved my life. I'm just so grateful for everything in my life, and I look at life different now.